Hi, welcome to this edition of Lunchtime Chat. Today we have Kevin from Trinity Behavioral Health with us. And for those who don't know, my name is Debbie Prue. I'm the Executive Director over at NAMI Pasco. And also on the line with us is my co-host, who I'll have introduce herself.
Wonderful. Thank you all for viewing, and thank you, Kevin, for being with us. I'm Natasha Pierre. I'm the Vice President of the sister to NAMI Pasco. I'm in NAMI Hillsborough.
Thank you, Natasha. Now, Kevin, can you just give us a brief overview of what you do at Trinity Behavioral Health?
I am the program director here at Trinity Behavioral Health. Signed on full-time in March, but I've been floating here and working here since September of last year.
And what
I've got a pretty good team.
Awesome. And what does a program director do?
We oversee the entire program, essentially, aside from the medical providers who are routed through a different avenue, but the therapists, social workers, we're responsible for the programming, the nursing functions.
Okay, awesome. Now, we know that a lot of our viewers are concerned about what's going on with the COVID-19 virus and the changes that it may bring to the healthcare system. Have you seen any increase in admissions since all this started?
We have not. Most of the facilities around the country have actually seen a decrease in admissions. For behavioral health, we're actually one of the few facilities that has stayed pretty steady. Some of that may be the impact in the surrounding area in Pasco County hasn't been as severe at this point. That doesn't mean it can't get there, but so far we haven't seen a huge surge in our community.
Now that's interesting. You said some of the communities are seeing a decrease. Do you have theories as to why you think that might be?
I think there's some general fear in the community, people trying to stay away from the hospital and not be introduced to the virus by showing up to the emergency room or their normally scheduled outpatient provider appointments. Some of those clinics are actually closing and not seeing patients. Some are thankful enough to be able to do telepsychiatry or telehealth screenings, but I think in general, people are just staying away from healthcare because of that fear of COVID-19 right now.
Okay, and we're assuming that there's been some changes to the admission process since this whole COVID-19 procedures have started. Can you walk us through what a typical admissions would look like now?
Yeah, absolutely. For the most part, the admission procedure is the same. There is one major difference, though. Essentially, any healthcare facility at this point is going to do a screening. First point of contact, as soon as you walk in the door, they will be asking you travel-related questions, symptom-related questions, and taking a temperature. And I think the CDC guidelines, everyone has pretty much adopted at this point. So we're going to be checking a temperature, asking if you've traveled recently, where you've traveled to, family members, contact, symptoms, those sort of questions. But as far as everything else, you may actually see a little bit smoother, quicker ride out of the emergency room. They have seen some decreased volumes around the country as well, not just with HCA, but overall. So you may actually get a smoother, quicker transition out of the emergency room into a behavioral health facility.
Okay, now what happens if somebody does answer positively for being at risk for COVID-19 when they come in? How would they be treated differently than someone who's just coming in that doesn't have any of those risk factors?
So there's an algorithm that we follow. If you were to come in and say you have a cough and you believe it to be related to allergies, you haven't had any contact with anyone who's been traveling or anyone who also had symptoms, it's kind of set up to where you would be moved to a different unit or a different place depending on how you answer those questions. For the very low risk people who just have a cough with allergies, they're more than likely going to be treated as normal. They probably would not meet the CDC or public health guidelines for a COVID test with no temperature and no other symptoms. So their admission process would be very similar. Now, if you were to come in and you do screen positive for more than 2 or 3 symptoms and you do meet those guidelines, they would perform a COVID test. And some of the facilities are different as to how they're responding to that. For us in particular, you would more than likely be admitted to one of the COVID screening units if you still needed either medical or behavioral health treatment. We would try to do a fast turnaround COVID screening. We hope to get those results back within 24 hours. And then depending on those results, you would either be admitted to the behavioral health facility or to the medical floor, where we would also be able to provide a psychiatry and some behavioral health treatment for you.
Okay, thank you. And we know that currently you're not allowing outside visitors. What is being done to ensure that that isolation isn't furthering people's mental health symptoms?
So we've been pretty proactive with that. HCA thankfully has the resources to be able to deal with this pretty quickly, and there were large organizations. We were able to brainstorm across our division and across the enterprise to come up with some solutions. One of those was Skype. We can do WebEx meetings, FaceTime. As long as it's not involving a clinician and a patient, we should be clear from the HIPAA perspective, so we don't have to rely as much on those HIPAA compliant models if somebody just wants to talk to a family member. So we've been able to use FaceTime, Skype. It's been pretty helpful, particularly for our geriatric patients who may be more separated than usual from the rest of their family.
That's awesome. And we know now that a lot of people are concerned about even contacting the virus while they're in the healthcare facility. What is being done to ensure their safety as a patient?
So the same screening that we would utilize for the patients, the temperature, the questions, the symptom questions, we actually ask that of all of our staff members every morning. So we're also tracking their travel, taking their temperature every morning, and we have a screening guideline. We use the same screening guideline that we use for patients for our employees. So every patient, visitor, even UPS, FedEx dropping things off, they come into the building, they get screened. All of our employees were one of the first facilities to utilize universal masking for our employees. So while those masks don't necessarily do a great job of keeping you safe from the virus, they do a pretty good job from what we can find as far as you passing it on to someone else. So all of our employees are wearing masks. We've also started with our patients universal masking as well. So we're not going to force a mask someone, if they're not wanting it, but the vast majority of our patients have preferred to wear one.
Awesome, thank you.
You walk into one of our facilities, nearly everyone's going to be wearing a mask.
Okay, and speaking of the staff there, what is being done? We know that there's an increased stress to them during this time. What's being done to ensure their mental health is being taken care of?
We have EAP programs where they can reach out and get counseling on their own. Mental health providers are not immune to those stresses and scares out there in the world outside of the hospital. So we do have EAP available. We're also starting a program with our outpatient providers where they're going to be mediating a conversation with providers outside of behavioral health. So they're going to be doing similar to a group with doctors from the medical side, ER nurses, anyone working in healthcare on the front lines right now that feel like they need to discuss it with a group. They'll have a trained outpatient clinician to help guide that conversation.
Oh, that's awesome. And now I know Natasha had a couple of questions as well.
Absolutely. Kevin, you all are the frontline workers. What's been the hardest part, first of all, for you, navigating this COVID-19, all of the changes? I'm sure policies are being implemented every day to keep everyone safe. What's been the hardest part of this for you?
Dealing with the uncertainty. This is a new virus that at the beginning we didn't know a whole lot about. We're still learning about it. We at least do have those national resources to learn new things every day about how we can better protect ourselves, protect our patients, protect each other. But that uncertainty, particularly at the beginning, was very concerning. Some guidance said don't wear masks, they don't help, and then guidance came out saying actually they do kind of help. So I also have a 5-year-old daughter at home. I think everyone with children or parents that they're taking care of, or just friends that you stay with, you don't want to come into a healthcare environment, pick something up, and bring it home outside and endanger the people that you love. That's been the personal struggle, I think, for most of us.
And across the news and social media, we're seeing our frontline workers, nurses, doctors, radiologists, etc., having a tough time because they want to go home to see family, but they're hoping that they're not going to transmit anything to their loved ones. And I know you all are for behavioral health. How's the morale right now for the staff over at Trinity? How is everyone feeling? Are people on edge? Are people concerned? I know internally you're doing everything to safeguard their physical health. How's the mental health, and how's everyone feeling?
I think there's definitely an increased anxiety level for everybody. I think that's why you're seeing some of these actions, trying to get together the division calls with our outpatient therapists. I think healthcare workers have a tendency to not take their mental health as serious. We kind of like to martyr ourselves, so we're trying to make sure we stay ahead of that and make sure we're there for each other. I think everybody's doing as well as could be expected. The team does seem to coalesce when there's emergencies, and this is one of those emergencies where I think we're all getting closer as a team.
And there are parents, I've received calls of parents who feel that their adult child may need a Baker Act. But their concern is, I don't want to send them to a hospital for a mental health condition and a physical condition develops as well. You've shared all of the ways that you all are not only safeguarding the employees, but also any patients that may be admitted. For any parents that may be watching that need the extra support, that know that a Baker Act, unfortunately, may be necessary at this time, but they've still got that reservation. What would you say to those parents?
I would say that your child's mental health is just as important as their physical health. And if somebody's in crisis and struggling, then they really need to take action on it. We are expecting to see quite a bit of depression, and the social isolation that quarantining brings is not good for anyone's mental health. So if you see someone struggling, please say something, please get them help. We're here for them. We will do everything we can possibly do to keep them safe.
Wonderful. Thank you, Kevin. Debbie?
Yes, I want to thank you again for being with us today. And I also want to let our viewers know that we have our support groups still running. We'll post those in our comments after we post the video. We also have text to peer available. And if you need any information on what we discussed about Trinity Behavioral Health, you can go to their website, which is, Kevin, do you know?
If you just Google Medical Center of Trinity, it will come up for you.
All right, and I'll also try to post a link to that in our comment section. As always, if there's an emergency, dial 911. And again, thank you, Kevin, for being with us today.
Oh, you're very welcome. Thanks for having me.
Thanks. Have a great day, everyone.
And you as well.